Thank you for all joining this morning. My name is Carolyn Lee, and it's my pleasure to welcome you to the first Pork Academy session of the day, titled Endemic Diseases, Biosecurity, and Other Hot Topics in Swine Health. I'm a PhD student studying African swine fever virus vaccine development at the College of Veterinary Medicine at Ohio State University. I'm honored to be part of the 2023 Real Pork Scholar cohort. So one of my big takeaways from being in the cohort so far has been getting real world and industry experience outside of the research setting. So it's my pleasure to be here, and hopefully my research can help the industries. It is my pleasure to introduce our session moderator, Dr. Brent Pepin, serving as the Director of Swine Health at the National Pork Board. Dr. Pepin has a doctorate in veterinary medicine from Iowa State Iowa State University, and has years of experience working specifically with the swine industry. Please help me welcome Dr. Brent Pepin.
Thank you for the introduction. So I just want to take a moment of silence so everybody can read our antitrust statement that I put up on the wall here. Okay. Well, moving on, I'd like to introduce our panelists. They're all going to be here today. So first we have Dr. Cezar. Dr. Cezar got his DVM and Master's in Veterinary Science from Brazil in 2020. And after practicing for 3 years as a technical service veterinarian in an autogenous vaccine company, Dr. Cezar joined the Iowa State University, where he's pursuing a PhD in population science and animal health, and coordinating the swine disease reporting system project that aggregates diagnostic data from the VDL and reports this information back to the swine industry. Then we have Dr. Lisa Becton. Dr. Becton is the Associate Director of the Swine Health Information Center. Her focus is on activities to fulfill SHIC's core mission to protect and enhance swine health, the U.S. swine herd, minimizing the impact of emerging disease threats. Activities include targeted disease research, support of swine health monitoring programs, analysis of swine health data. Dr. Becton served as the Director of Swine Health for the National Pork Board for 15 plus years. When she went over the SHIC, she made space for me to be hired. She will focus on biosecurity research and swine health issues. Prior to her time with the Pork Board, Dr. Becton spent 14 years as a staff veterinarian for 2 integrated pork production companies, managing swine health, biosecurity, and transportation issues. And we have Dr. Laura Dalquist. Laura grew up in rural Lafayette, Minnesota, was an active participant in 4-H and FFA, and competed in the livestock judging. She attended undergrad and vet school at the University of Minnesota, where she found her passion for pigs through internships and externships with vet clinics, and the same with production companies, and works with some of the same production companies that she works with today. She currently works for the Swine Vet Center in St. Peter, Minnesota. Laura enjoys working with producers and caretakers to improve health and performance of sow herds and growing pigs. She's especially passionate about teaching and training, planning, and executing disease elimination programs in all aspects of biosecurity and biocontainment. And then last but not least, we have Dr. Deborah Murray. She received her DVM in 2006 from the University of Minnesota. She practiced mixed animal in Marcus Remsen, Iowa, out of school, and then moved back to Minnesota and worked for New Fashion Pork in Jackson in 2007 and has been practicing there since. She is a past recipient of the Science and Practice Award, as well as the Young Swine Vet of the Year Award through the AASV. So we'll now give a chance for each of our panelists just to give just a brief introduction of the work that they've been working on and what their focuses are. So we'll start, Dr. Cezar.
Okay, good morning, everyone. It's a pleasure to be here, and thanks for the invitation for the National Pork Board, and also to share this panel with these amazing veterinarians here. And for today, I'm going to try to give a big picture of what is the scenario of the endemic disease here in the US based on the swine disease reporting system that Brent mentioned. There is a project that aggregates diagnostic data from the veterinary diagnostic labs, and then we report back to the industry. It's free, you can have access to these reports, and have all this information about 8 endemic pathogens. Because of the time, I'm going to share only about information about PRRS and enteric coronavirus today. But how the project works is that every case that is submitted in one of the 6 VDLs that we have in the project is aggregated to us, is anonymized data, so we don't know which producer, which veterinarian submitted. We just know there is a case with ID, which pathogen was tested, and which specimen was submitted, so oral fluid, feces, whatever you submitted from the pig, and the age category that this specimen came from. So with this data, we can aggregate all of these and see the trends of detection by state in the whole country. So for PRRS, for example, I'm going to start with the good news that last year, we had the highest number of cases that were submitted from the win-to-market category. So it means that the swine industry nowadays is doing more surveillance in the finishing sites. And for me, this is good news because we are investigating more if we have more disease in these finishing sites. On the other hand, when you look to the diversity of PRRS, right now we are having much more strains in the field because we have sequencing data in this database as well, and we see more different lineage and more different genetics of this specific virus, which is not good because it increases the activity that we have in the field nowadays. And moving to the enteric coronavirus, what we have for good news is for the TGE, we didn't have a single positive case since 2021. So it's a pathogen that we didn't do anything for that, but it seems that we kind of eradicated or is circulating in a low prevalence right now in the US. So it's 3 years of data. This is more than 130,000 cases that were submitted to these VDLs, and none of them were positive. But on the other hand, again, for the PED, we are having more activity in the win-to-finish sites. This year, for example, we didn't have a lot of activity of positive cases in the sow farms, but when we look to the win-to-finish sites, we have more positive cases than last year in this last season of the winter. So a lot of lateral breaks that we have, and these cause this increased activity that we have nowadays. We have more 6 other pathogens in the report as well, mycoplasma, PCV2, PCV3, influenza, and also Delta coronavirus. So if you guys have questions by the end of the Q&A section, I'm here to answer as well. Thank you.
And Dr. Becton, want to give?
Yeah. Hey, good morning. Again, thank you for the invitation to be here to be on the panel and to talk with you all today. As Brent said, I'm with the Swine Health Information Center, and our goal really is to reduce impact to producers for emerging diseases. However, with that being said, we also, impact endemic diseases by our global disease monitoring, our domestic disease monitoring, looking at animal health data and trying to identify when something is not normal or not expected and go and investigate that further. And then we do that through targeted research programs. And to give you a little bit of history, Swine Health Information Center, now I'm going to call it SHIC because it's easier to say that. We were originated in 2015, especially 2 years after PED, and that was funded solely by a National Pork Board and checkoff funds, because when we looked at the response to PED, all of us in the industry were looking just at PED, and we thought, holy cow, we didn't realize this disease was coming, and we didn't realize the impact that it had. And so collectively, all of us, working in the different industry associations said, we need to have an organization that is solely focused on what are potential threats to help us being prepared for those threats. And so whether that's understanding if there's vaccination available for new diseases, if there's diagnostics that can help identify those diseases, but then also just have a finger on the pulse globally of what is coming out and what pressures are out there. And so those are really our core functions. And so Dr. Cezar mentioned the swine disease reporting system, and we do fund that. We also help fund another program, the Morrison Swine Health Monitoring Program. And the goal of those programs is really to assess and identify what's happening in the industry with swine health. So disease occurrence, disease prevalence, what do our cases look like, and then what do we do about them? So for example, recently there was astrovirus, and you'll hear a lot of viruses because those are something that really are a challenge, but it was identified as being a potential pathogen, and so that instigated some further research into saying, is this virus truly damaging to pigs? And so you have to investigate it by taking that virus, putting it into pigs, and seeing the response. And that takes time and money to do, but it helps us determine if this is something we really, truly should be involved with, or is it an incidental finding? And so those are things that a lot of times, we don't always think about it. People see endemic diseases, PRRS is challenging, but it is important to also understand what is changing. And because endemic diseases may have a new presentation, and that's also what we're trying to monitor for. And so that's just a very broad overview of what we do. And our goal in endemic disease preparedness and planning is to help support identify changing trends, support our disease monitoring, and also understand our diagnosis and diagnostic tests. Do we have the appropriate tests to be able to detect these diseases and trends and changes?
Dr. Dalquist?
Yeah, so maybe a little bit more on my history, and thank you for inviting me to be part of this panel. But I, for the last 16 years, have been really fortunate to be able to work with mentors like Tim Lola, Paul Yeski, Mike Eisenmenger, and the others at Swine Vet Center, as well as our amazing clients, where we focus a lot on making healthy sows that make healthy pigs. And so one of my passions is really disease elimination, biosecurity, biocontainment like we talked about, and working on the multiplication side, building plans and protocols for testing so that we, if I could say never, we would never have any disease transfer from a multiplier into a commercial sow herd. So that's really where my passion came from, is working through that. We very much value healthy sows and producing pigs that everybody would want to raise.
And then Dr. Murray?
Thanks again for the invitation. So as mentioned earlier, I work for New Fashion Pork. So we're about 60,000 sows, and we'd raise about 1.2 million pigs a year. And through that, so I would do a little bit of everything in terms of biosecurity, vaccination programs, that sort of thing. But probably my real passion is solving problems. So like I would like to go in, and if there is an issue, I'd rather prevent it and solve it rather than have to go in and treat it. And so that's sort of our goal. We do a lot in terms of research and looking at different vaccines. If there isn't a vaccination for something, trying to come up with how we can make something work, how we can input that into the system, and really get healthier pigs. And as Laura mentioned, healthier pigs on arrival, right? We want them to come in healthy and then just stay that way. And so we work on a lot of biosecurity and other things there.
Well, thank you. And now, this session is for you guys, so it's now opened up. And please, anybody who has questions, please go ahead and ask them at this time. We can bring mics. We'll bring mics to you. Well, to get things started, I do have a question for Dr. Dalquist, and Dr. Murray, please chime in as well. So when you have PRRS obviously is, and it's not going away, it's here. How do you guys decide when you go into a farm and you have a PRRS break? When do you decide to try to eliminate, try to control it, or go to depop?
Yeah, so complex question right off the bat, right? So when I look at a PRRS break, the first thing I'm going to look at is cut pattern, though maybe that's not what we should be looking at. It just takes a little bit of time to get back the whole genome sequence to really understand the virus completely. But the cut pattern will give us an idea of what that virus might do in a farm. And so I want to know, how severe might this get, right? With the 144s and the 124 L1Cs, they've been really devastating on sow farms and in downstream flows. And so I would kind of consider those as maybe that's something we would want to depop right away. But the other thing I want to know is, what's the history of that sow farm? Is it a sow farm that's broken frequently? Is it one that hasn't really broken in the last many years? Because that might give me an idea, too, of whether we can keep it negative if we do invest the money in depopping it. So I want to know that history next. And if it does have a challenging history, are there some things that we could do to improve the biosecurity of that farm while it's depopped, and then also do some education and training of the staff to make sure that we maintain our biosecurity protocols and keep it negative and get our ROI on it. The other thing I want to know is, what's the area like around that sow farm? Are there farms that we would have control of with that producer that has a sow farm there? Or are there multiple different entities that own growing pigs in that area because they will definitely put pressure on the sow farm. And then the other things you need to kind of take into consideration is, do I have gilts to repop that farm with? Am I going to be able to get those culls sold soon? The other thing is, you know, maybe this sow farm is in an area that it's around other sow farms that we want to protect. And so getting it out of Dodge soon is a really good idea. But then kind of, you know, back to the question of, well, baby, what if you choose to stabilize or eliminate? That's probably something I would do if it wasn't maybe as severe of strain, or it was, you know, a farm that wasn't around other privileged farms, or it had, you know, maybe not a great history where we're breaking continuously. I'm not sure how to get this farm to stay negative. I'm going to work down the path of elimination more so. And I would say with those, at least with my experience, I'm probably going to be less likely to just stabilize and maintain a positive herd because of the recombination and, you know, making different strains in that farm. So I definitely am more likely to go toward elimination of those than to just maintain a stable herd or a positive herd. Deb?
Yeah, so I think this is a different conversation today than maybe 5 years ago. So unfortunately, like, in my opinion, we now have high path PRRS. You know, we used to have, you know, PRRS was predictable. We could do a herd closure. I'm going to get rid of this in 220 days or 30 days or, you know, whatever your number is. And everybody sort of knew what to do, and we all did it, and we would clean them up. And we kept doing that, and all of a sudden PRRS changed, and now they don't clean up. And so we're now getting out to these 300-day closures, and then you're running out of gilts, and there's a lot of other implications, you know, production implications that are involved with that. And, you know, not weaning a pig for 6 weeks due to the high pre-wean and the stillborns and the sow mortality. So I think a lot of it really is a predictability. So if you can tell early how severe it's going to be, that makes your decisions easier. And so some of those things that we've looked at is if a viroid's a rapid mutator. And so initially on a break, historically, it would have been like, oh, we got a sequence, that's what it is, you know, proceed. Now, we'll sequence 3, 4, 5 different times early, and if you see a tiny change, so it's not 100, 100, 100, if it's a tiny change, well, it's changing fast. And that right there is going to tell you that it's going to keep doing that, and you're going to have a long road ahead to get rid of that. So that sort of helps make your decision, okay, can I withstand a 300-day closure and go without gilts for that long, or do I depup? And the same thing on the severity, the cut pattern, especially like the lineages, and that's kind of something now that's a, you know, with the 144, they're like, oh, it's an L1C. What's that mean? So it's a lineage 1C, so that's sort of the family. And so that right there kind of tells you what you need to know. And it's like, oh, this is going to be bad. So when you get that and you can make that decision, I think that makes things go a whole lot smoother, because then it's like, okay, we don't have to feel like we've left something on the table by depopping this farm that we could have recovered, because we're going to have a tremendous loss in the process.
Maybe one more addition is to look at is, you know, if there's other health concerns on the farm already, like a mycoplasma or some other disease, it does make that a little bit more appealing to depup that farm, and your ROI would be greater.
Any questions from the audience?
So this is just a general question for any of the vets on the panel this morning. What do you see as the most common mistake that producers are making on their everyday production in the barns from, say, a biosecurity standpoint that leads to recurring endemic disease? And then maybe once you guys come in, clean them up, everything's doing well, is there a common mistake that then, you know, like biosecurity maybe gets better for a while, and then people maybe fall into a bad habit and it comes back again? What are the most common things that you see in your practices or in your experience with research as well?
So I would say making things overly complicated. So we haven't engineered ourselves a solution for simple. So when we're having to jump over this bench and put these boot covers on and like do all these things, are we really expecting that to get done right every day? And so that, I think, is where we start at. So do we need to take a step back? Is there something different we need to do in terms of building design or barn design? And again, today isn't what 20 years ago was. PRRS is different. We have PED now. There's a lot of other complicating factors. And just because something used to work, it's not working now. So I think engineering yourself a solution is your best bet to begin with, because the more that we ask people to do, it's like, man, they're already doing these chores and taking these dads out and doing all these other things, and then we're just adding so much more to their day that, like, if something's gonna get cut, that's what it is. And then they break, and then they get more work, unfortunately. But yeah, we just need to try to make things simpler from the beginning.
One of the things I know from a SHIC perspective that we try to have as a tool for people to use is the Swine Outbreak Investigation Program, and that's based on the SHIC website. But the design and the focus of that is to really help identify where are the weaknesses in a different system or in a farm outbreak. Also, that program is designed to aggregate the data to be able to identify what are the trends that we're continuing to see. So, for example, we know transportation is still a huge issue because anybody that's ever dealt with it, had to wash a trailer, clean one out, turn it around quickly, knows it's not an easy process. It's dirty, it's time-consuming, you get wet, it's not fun. And so, along with identifying weaknesses, we're focusing on research, taking input from veterinarians and producers to say, what are novel technologies we can utilize to make the wash procedure of transportation easier or more effective? So trying to find alternative solutions. The other part is also looking at biosecurity and how do we enter and exit farms? Can we find novel ways to do this better? Can we redesign buildings or entry systems? And so for me, obviously, my passion is research. And so from a SHIC perspective, we are trying to investigate with y'all's feedback, what are those key issues that need to focus on? And so a big one for us is on the grow finish side or wean to harvest, because that's still to some degree a weaker point than we have on the sow side.
And just to complete a little bit of Dr. Becton mentioned, from the perspective of the diagnostic data, it's something that we are doing more as well. Like we receive more truck samples, more door handles. So this is something that is increasing over time because of the challenges as well, of course. But if we keep doing that, monitoring the trucks, monitoring the vehicles, and also the facilities as well, we can improve this biosecurity part of our farms as well.
Yeah, I agree with Deb on the simplicity and keeping things as simple as you possibly can, but also providing that clarity and training for the staff so that they know exactly what they're supposed to do whenever they come, in contact with the outside, essentially. And then the other thing that I think is really important is validating that our protocols are being followed through assessments or different, observations. Maybe going to the farm and saying, you know what, I'm just going to watch how you guys are loading pigs out today. And see how that process goes. Maybe not really say anything during the process, which kills you to see something done wrong and not say anything, but then review the process after the fact. Come back to it and say, okay, how could we make this better? What should we be doing? So.
Just a quick follow-up for Dr. Murray. Could you share some examples of things that you guys have implemented that maybe fit into this?
Yeah, so I think part of it is that you have your single wide barns, and then you have to go outside between every barn, right? So then you haven't a chance every time you go outside, and to ask of a change of boots or coveralls between barns like that is almost impossible. So it's things like connecting those barns, making a shared hallway, maybe even making a chute, in the middle there versus having a portable chute. So you're taking that chute from site to site to site. So it's improvements like that, structural improvements that just make things simple so I can shower in one time, have one entry point, and be in the site.
So Lisa, you mentioned that SHIC funds research. Can anybody access that research, and where does one find the research that SHIC's been doing?
Yeah, sure. We do fund a lot of different research, so covering a vast array of issues, both emerging disease and endemic. And so if you want to go see those, both the what's been funded and then also results, please go to swinehealth.org, and you can go through our whole website. We've got research listed, and it'll show you results. We also publish a newsletter because our focus is really not to hold the information, but as soon as we can, get it out so people in the field can utilize it or make changes. And so that's something that's really important to us.
What do you have an update for flu in the industry?
Yeah, like this year for the spring was kind of different from the last years because usually we have a spike at the beginning of the spring every year for PRRS cases, for influenza cases at the beginning of the spring. And right now was a little bit delayed, and we thought that was something related with PRRS. For example, as Dr. Murray mentioned, we are having like longer closures. So probably like this affected a little bit the flu season. But right now, for this specific month, what surprised me is that we had a drop in the number of cases of PRRS, of submissions itself. So we still are trying to investigate that because it's not common to have the drop that we had, and why the producers were not and the veterinarians were not testing that much this last month. I don't know if it was the high thing that was like everyone getting afraid of that is going to cattle, for example, and if it's that why may affect this testing part in the pigs as well, but we are still investigating that to see. But in terms of clinical cases, in the VDL, in the ISU VDL, we also monitor all the cases that the diagnosticians, they take a look. So tissue cases that are submitted and they look to the histological lesions. And we had more influenza associated with other bacteria as well. We are having more influenza with Glasserella, more with Streptococcus suis. So we are having more co-infections this year comparing with 2023.
Every day we're on eggshells in the sow unit, in the wean to finish barn. Any little mistake, like you guys have kind of talked about already, can cost you $1 million. Is there any effort being made or any thoughts around making a tougher pig?
You know, this is more of a broader perspective just from my time in production. I think there is a lot of work that goes on behind the scenes when we look at the different genetics and breed stock. So, for example, many years ago, there was an effort to look at E. coli and how do we reduce E. coli in pigs and looking at through the genetic development. Another one, obviously, that a lot of you have probably heard about is through PRRS, to look at how can we get a pig that is resistant to PRRS. And so they did a lot of upfront work understanding the genome of that virus to be able to identify what genes are needed and what genes can we remove to help build resistance. And then they start to breed that pig towards that. But just like you said, any kind of genetic improvement is taking time. There is new technologies out there of gene editing, but that's also under discussion because what does that mean downstream if we utilize gene editing technology? Will consumers accept that? What happens? Because it's not only just us in production, but we're raising protein. There's also efforts looking at that for ASF. And so I'd love to say it's a quick process, but that is always back in our minds as far as production standpoint, disease standpoint. So until we get that, I think our focus is still accurate and early diagnosis of an issue and trying to really do everything we can to prevent something from happening, or like Dr. Murray said, take action very quickly if you do and try to figure out how can we better respond and nip something in the bud.
I would say there has been definitely a push for that on the genetic side, looking at, the pie's only so big, right? So we really wanted this fast-growing pig that gained like crazy and had great feed conversion, and the sow had 20 pigs and all these things, right? So then what's going to give? And that's what gave, right? So then you're exactly right. It's a more fragile animal. And so there has been a trend to go back and has select a lot harder in livability. And I've seen that across multiple genetic companies. It's not like we're not super fast at it, right? But it's going in the right direction. But that being said, though, something will have to give. So that might mean a slower growing pig. That might mean less born alive, right? That something's going to have to go along with that. And so I think that if the producers are willing to sacrifice some of those other things for a hardier animal, it absolutely can be done. Yeah.
I just want to compliment you. That was an excellent question. We all feel the frustration in pig-dense areas of the aerosol spread of PRRS between finisher sites. Is there any new technology or any antivirals, anything you can do to help us out when biosecurity doesn't fix the problem and we've got to go down another road and try to save as many animals as possible? Is there anything new or breakthroughs?
So we're not really allowed to use antivirals. That's not an option we have, unfortunately. So then our next best strategy is, trying to reduce fevers, reduce inflammation. And so there are some new products that are available. Meloxicam is one of them. That's a stronger product than something like aspirin. And so the problem with things like aspirin is the aspirin you and I take is buffered, right? So then your stomach doesn't get an ulcer and you don't have these other issues. The aspirin we run for the pigs is not. So we can't really run it at a high enough rate to get the effects we really need. So that's where I think some of these other anti-inflammatory type products, I think, are going to help a lot, and I think that they already are. So there's some of that's coming into play, but I think we definitely need more.
Yeah, and I think focusing on biocontainment a little bit more too when we do have sites break. If there's something that we can do to prevent the next one from breaking, that's really the other focus is, what else can we do to prevent this from spreading to the next site? I realize aerosol spread is really tough in unfiltered farms and especially dense geographies, but there are still some things that we can do to prevent it from spreading.
There is some work too looking at how do we treat the air or how can we prevent it from getting out. So using electrostatic particles to try to drop that virus out and get it to stay in the barn versus come out. So there are research projects looking at that as well and other technologies maybe that you can use on a whole barn basis. But there is research trying to, again, address what are different technologies that we can use that are effective under barn conditions, because you have to combat dust, high wind, high air speeds, and so it's not quite an easy project to fix, but there is focus.
And we are also getting more diagnostic tools as well, like the whole genome sequencing. We are still learning, but we might be able to track like, this specific strain, because they have this specific genetic material, is easier to spread through like aerosol or this kind of spreadness. So with that, you can keep track and say, okay, this is a strain that I should depopulate because I think it's going to affect the whole area here. So still investigating, but yeah, we are moving on that direction.
My question is directed primarily to Laura and Deb, but as you evaluate, as you work with live production managers and nutritionists, how do you evaluate products to minimize, maybe not totally prevent, but bacterial infections, viral infections? What are the steps you follow as far as, consideration, evaluation, implementation? Because I know it's a very complicated process in communicating and stuff like that, but what are the kind of the steps you follow before any implementation or changes? And I guess it could be to everybody, but I know that in production systems, you're working closely. So it's primarily directed to you two.
So I would say, there's got to be some good science behind it to begin with, right? So we need to have the science behind it, understand the mechanisms, how these things work. Then after that, generally we'll do a small, in-field evaluation. If it looks promising, then we would spread it out farther, maybe to more barns or research facility where we can do some statistics and analyze the data and see what results we get. But it has to look promising enough that you probably have a 3-to-1 return or better. So if it's something that's not going to gain me a lot and is really expensive, probably not going to be looked at.
Yeah, and we would have some research barns that we do trials like that in and try to compare different options that we would have and just make sure that it does have that return before we put it out there further. But field studies are really important for production companies as well, maybe even those that don't have their own research barns or have access to research barns. But that's been a very effective way to at least just trial things and see, is this something that we want to pursue further? And like Deb said, if it does have the return, we're probably going to put it into multiple barns.
I think from a research perspective, we kind of provide the science. So we'll start and go out and ask, okay, our veterinarians, what are your biggest challenges and what do you need help with? And so then we can formulate a research plan to address that. Because, whether that's understanding the transmission, understanding the virus or bacteria, know what it does, how it affects the pigs, how it transfers, can we detect it? And then start to work on the priorities too, to prove here's the basic science, now here's how we can apply it in the field. And with both initial disease or basic research, but then also help to trial some of these things out in the field, because you're right, if we don't do it in the field, just because you do it in the lab doesn't mean it's going to translate over. So it is a process, but it's a collaborative effort and a constant feedback loop of what works and what doesn't.
I would say also we want to reevaluate when we do put stuff in the field. We always want to go back and say, okay, is this still working? Are we still getting the return that we thought we were initially? Because things change, right? So.
And one thing that I always try to address as well is try to push to the pathogens not happen at the same time, because sometimes, okay, we are going to have all of them, but if having the same period of time, it's going to be worse. So sometimes using a vaccine or a specific post-medication to push these pathogens to happen in the end of the finishing part, or at least like not happening in the nursery with all these pathogens together, is a strategy that I try to do as well to avoid having more mortality and also losses.
There's always talk about eradicating diseases like PED, maybe even possibly PRRS. Is it possible? What are the steps? What are your guys' thoughts?
Yeah, I think the PED one is definitely really big right now. We've got a task force that we stood up within the ASV, and I believe that we can get it eliminated. But that's kind of what's instilled in me, is getting rid of diseases, right? And so there is a lot of work that's going into that Lisa probably can talk more to than I can. But yeah, I would say I think that's possible. PRRS is going to be a lot tougher until we get tools like, the genetic capabilities of resistance and stuff, but I do believe in PED elimination.
I think we look back on pseudorabies elimination and even classical swine fever, right? So we had a vaccine that worked great, something that didn't mutate or change a lot, and everybody was on board, so it wasn't a choice, like everybody's doing it. And I think that's the key in all of this, is that if there's enough of a push and enough of a producer push that we want this and everybody wants it, it's doable, but it's getting everybody on board to do it.
Okay. Well, looking at it from a research and a monitoring standpoint, it's trying to understand what are some of the unanswered questions. So SHIC, we do research, and we're focused too a lot on their diagnostics. Can we use, one diagnostic test that tests for all coronaviruses? Because PED may be the big one we think about, but porcine Delta coronavirus can also be a challenge. So how can we better detect it? How can we quickly detect it? So we're focusing on those things, focusing on our biosecurity. Can we identify, weaknesses or gaps, and then focus on how to fix those? But it's still also a collaborative effort. So with the National Pork Board also does endemic disease research, and so they're also looking at what are some additional gaps. Is it how we handle manure? Is it how we, move it around, either trucking? So it's obviously not just one entity, but I think all of us within the industry are really looking at where can we help fit in and fill the needs and the gaps to make that happen.
Yeah, and just to emphasize a little bit of Dr. Murray mentioned as well, I think, in my opinion, should be something that is be mandatory. Like if we decided to eliminate, it has to be like everyone trying to eliminate, because imagine that, okay, I'm trying to eliminate, but my neighbors are not, so I'm always going to get breaks and breaks because of lateral introduction. So if it's not the whole industry trying to eliminate this pathogen, I don't think it's going to work, in my opinion.
What percentage of farms use air filtration, like HEPA or otherwise?
I'm not sure if I know a percentage of farms that would use air filtration, but at least we're in our client base, I would say the majority of the sow farms at least are filtered, and we're even looking at nurseries that are around sow farms and then GDU sites. So a good a good percentage of the ones that we would work with are filtered.
And I'd say probably the majority of the boar studs, unless it's in a very remote location, those are probably going to be filtered. And then a lot of it kind of does depend on geography. You know, so if you have a farm that's in the middle of nowhere, probably not going to filter that. You know, and you may break every 9 years. You can't pay for filters. So if you're in a more dense area, I would say your probability of being filtered is substantially higher.
So as you look out over the horizon then, are there any specific diseases that you're watching that are either active overseas currently and worried about coming to the U.S., or that may be developing that you're noticing genetic signs of, stuff like that? So if anybody wants to talk about what's over the horizon for us.
Sure. I guess I'll take that one for now. We do a couple different things. We do the domestic disease monitoring, but we also work on a global disease monitoring. So once a month, we have people that are constantly through the month looking at what's happening. They go through multiple reports, talk to veterinarians that are working overseas and internationally, and seeing what's out there, what's happening. Obviously, ASF is kind of the elephant in the room, and we know that's a challenge, but we're still looking at things like foot and mouth disease, classical swine fever. And then a couple years ago, Australia had suffered a break from Japanese encephalitis virus. And so that is a virus we do not have in the United States. We have another virus, West Nile, that's in the same viral family. So some of the questions that we had when we were observing that Australian outbreak, and we knew it affected pig farms and people, so that raised the level of concern. We needed to understand, how much is the U.S. at risk? What areas, is it a northeastern issue? Is it a southeastern issue? Does it, depend on mosquitoes? Do our mosquitoes here in the U.S. carry the virus or be able to infect? And so we started a group that got together and said, what are the main priorities and things that we needed to address and understand for JEV? And so there was 13 different priorities, and SHIC put out a call for research proposals, and we just received those and are going through them now. But we're trying to understand, again, what's at risk in the U.S. Let's understand mosquitoes and their behaviors, looking at diagnostics and even potentially vaccine development, because there's a human vaccine but not a people vaccine. And so we're looking at all of those things. So that's probably one on the horizon. But again, constantly monitoring, because, viruses like to change, and so we always have to be on the lookout.
You guys are asking great questions, so don't be shy now.
All right, I'm going to turn it around and go, what diseases and what challenges do you all face that are of concern? Because, you can hear us talk, but we'd love to hear from you guys too. What makes you not sleep at night? Sorry, didn't mean to turn the program around.
ASF, you want to talk about that?
Yeah, that's all of us.
Yeah.
Purse. Lots of purse.
If you knew of some technologies that are proven, that are things that maybe most of the people in the room here have never heard of, perhaps you have, how would I reach out to you and share some of those things?
Well, I would say things like this, right? So like being here, that's right. Like you're just getting your message out there, right? So like being here, even AASV meeting, they have a lot of vendors there that, you can give presentations. They have an industrial partners session that share information that way. So I think any of that is good and at least gets the awareness out of what's available.
And there's different functions. You can, email or send targeted messages to any of the industry organizations, because we are routinely screening and scanning for what are our priorities for next year. And so having that input and having that information helps us understand, is this something we need to investigate further or not? So yeah, that's always a good way to do that. Just reach out on our various websites and say, hey, we got this.
Yep, you have 4 new contacts here too, so feel free to reach out.
Hi, I'm Rowena from Australian Pork. We've got a group of Aussies over here at the moment learning from you guys on a study tour, and so thank you for mentioning Japanese encephalitis virus. It was an interesting way to have to deal with that virus, especially with the human aspect. But our preparation with ASF actually put us in really good stead for responding to JEV. So completely different virus, completely different mechanism of spreading the virus, but it put us in really good stead, yeah.
Okay, I have a question. Okay, when we think about outbreaks, do you think that this virus or bacteria or whatever is brought to the farm, or it is from our workers?
Which virus specifically?
Are you just talking about any infection?
Yes,
Okay.
yes, in general. Like any disease is brought to the farm for another reasons, like external reasons, or by the coworkers?
Yeah, I think the first step, usually when I would detect an outbreak, is to go and do an investigation, like Lisa was talking about. You know, I want to know, where could this have possibly come from? Just your exact question is, did it come from, you know, someone taking it across the line of separation? Did it come from the air? Do we have gaps that we need to fill on the farm? And so that's definitely the first step, is trying to figure out where it came from. And I would say, to answer your question, it could be anything, you know. It could be any of those routes. And so you certainly walk into a farm and eyes wide open. You're looking at everything just to try to see where it might have come from.
Yeah, and I think many times it's a combination, right? So we have something that brings a virus to the front door, but then we've got to walk it in, you know? So I think it's always both, really. And so it's a combination of all the above, and it's very difficult to prove it, you know? So like that's the challenge, right? Is we know there's all these possibilities, but I can never really say for sure it was that, you know? Maybe not never, but rarely. So I think that's the challenge, you know, and like a lot of these situations, it's a lot of things that come together in the wrong way.
Yeah, so after any disease investigation, I want to identify what are the main priorities of the gaps that are there. What can we fix quickly, and then what's going to take a little bit more time, but what's the highest priority that we need to get fixed today, and plug that hole.
I just kind of with a follow-up to that too. What if you know that there's, I mean, we know PRRS is going to be in a lot of neighboring farms, but if you know that's like a direct threat to a certain site, are there certain biosecurity procedures that you would implement right away that'd be beyond what you normally would do?
Yeah, so good question. I would say, you know, doing something with the entryway, as far as if we're not always doing disinfectant in the entryway every night and cleaning it up, that would be one thing. Going through and evaluating the farm from a filtration standpoint more frequently than what's currently happening. Going to that farm right away initially with an expert to just make sure everything's sealed up would be probably an approach I would take. And then is there anything I can do with that site that I know is positive? Whether it's move those animals out of Dodge or try to do something from a biocontainment standpoint with some of the research that's being done right now is putting covers on some of the fans and things like that, and just trying to decrease that shedding that's happening in the neighborhood. Deb, you probably have more.
Yeah, so I mean, I would say it's two things, right? We want to prevent that from happening again. So how do I do that? But then also, I want to sever connections from that site to others so I don't move it. Right? So like that's the first thing I would look at is like, okay, how is this connected? Who's choring this site? Can this be chored separate? Is there a common dead pickup? Can we make that separate? Like what do we need to do to make this separate to contain it as best we can? Because like people try their best, but mistakes happen. So if I just don't have a connection, you can't make that mistake.
And I think not assuming anything either. You know, ask the question. Don't just assume, well, this is what's happening. You know, really understand what's going on the farms that would be impacted.
We do have, from a SHIC perspective, a funding of a project, the Rapid Response Team, that is a third-party group that can come out and help in outbreaks, especially if it's something that, isn't expected. You don't have an understanding of why this happened. So if you have a farm, say out in the middle of nowhere, and all of a sudden it blows up with a disease, and you don't know why, sometimes there is funding available to come out and have additional groups to do that, and also do additional diagnostic work, because sometimes we may go investigate farms and you still come out and go, I don't know why this broke. And so there are additional tools over and above just normal everyday operations that can help with outbreak investigation.
Hello again. So obviously we're quite lucky in Oz that we don't have PRRS, so respect to everyone in the room here who has to deal with that on a daily basis. Obviously dealing with disease can be stressful and taxing, and so what are some tips about keeping morale up on farm and really working with your people to support them, on a daily basis?
Yeah, that's definitely, it takes a lot of effort. When farms are going through breaks, it's really tough for them. They've put so much time and effort into the product that they want to deliver to the nursery, and now it's ruined, So coming out and bringing meals and things like that to the farms helps a little bit. Just being there and helping them to do the work sometimes is what they need. Providing any positive reinforcement that they can have, that they're doing a good job, and just kind of keep that positivity on the farm. But I would say, adding resources and providing whatever you can to them that they need, and really find out what do they need to get through this. The other thing is clarity. Sorry, Deb. Clarity on, what is the timeline? Like, what's the typical timeline of a PRRS break, and where can I kind of get to the light at the end of the tunnel here? That does help them a bit to know that, it's going to be rough for the next 6 to 8 weeks, but it's like we'll get through it in this amount of time or around this time.
Yeah, that's exactly right. So that's what I was going to add, is just the educational part about like what is going to happen, when is this going to happen, how long is this going to take, and then just taking that minute initially to just explain. So one example, I was at a farm and broke with PD. We knew it. We got there. It's like I'm busy making plans, and we're going to wean down and do this and do that, and everybody was sitting in the office, and I waited a minute, and it's like, oh, like they think they're going to get fired. And we asked them, like, do you guys, are you worried? And they're like, yeah, are we going to lose our jobs? And it's like, oh, no, and so like just taking that time to explain that and letting them know what was going on. And it's like, no, we're going to need you. This is what we need to get done. Like at this point, what's done is done. We're moving on. We're going to make the best out of it that we can. So I think that just like conveying that message to them, and then the follow-up visits, and like, getting the supplies they need, all of that.
And another thing is for Dr. Becton mentioned about the outbreak investigation, because I saw many farms that the employees said, no, we have done everything right and we still broke. So they want to understand why they broke so they can fix that and not happening again. So a lot of times we get this question like, why? Why is this happening? And so that's the importance of doing the outbreak investigation as well.
Dr. Cezar, I know with the STRS, you also link it to some tissue diagnostics as well. Is that correct?
Yeah.
Maybe you can elaborate on that just a little bit more.
Yes, that's what I was mentioning before as well. Like for the reporting system, we have also diagnostic data only for the ISU VDL from the diagnosticians. So they analyze the case, they look to the lesions, the macroscopic and the microscopic lesions, and based on that, they assign a confirmed diagnosis. So, this was an influenza case, I'm pretty sure. So they write that in a report, and this goes to our database so we can report back to the industry. And as I was mentioning, this year specifically, we are having a lot of co-infections. So they are seeing a lot of cases of influenza plus bacteria agents, PRRS more bacteria agents. So it's a trend that is happening more this year compared with the other years, and we are not sure why. But yeah, according to our database, we are having more of these co-infections cases, and this might be affecting also the mortality and also the performance in the farms.
Thank you. I want to ask one thing, because in the end, you mentioned that there is a correlation between bacteria infection and the virus infection. So my question is, the virus infection is more related, in your opinion, to the depression of immune system because maybe the antibiotic used, or because the bacterial toxics or lipopolysaccharides free in the lumen of intestines, pro-inflammatory cytokines, etc.?
That's a tough question. Yeah. Yeah, I mean, it's really difficult to answer that. I mean, at least with research data, I'm not aware of if there's any publication that says that, like if one of them come first or if one is depressing and the other is coming. But based on this diagnostic data that I mentioned to you, usually the virus infections are happening first, and then we are having this depression in the immunity. And then the endemic bacteria that they are in the farm, right, they are there, like, Strepto, Glasserella, like they are there. But when they are endemic and they don't have any other factor that is affecting them, they are quiet. But when they come, this virus infection, and mainly what we mentioned, like these strains that are more aggressive, that are coming in the field, so we are like having more of this bacteria as well because they are depressing the immunity, and then these bacteria are rising and causing more disease. I mean, in my opinion.
Yeah. Well, and I think too, like there's always multiple, right? So there's never just one virus or one bacteria. So it's usually, okay, there's PCV3, there's Circo, there's PRRS, there's Rota. So there's all these things, and so like they can kind of handle so much, and then it's sort of the straw that breaks the camel's back. So it's that one extra thing that sort of pushes them over the edge. And so I think that's also something to take into consideration, are like, how many are we dealing with here?
Yeah, and I think that comes back to the monitoring. You know, a mantra that I've always had, you can manage something if you have the metrics for it. And so it's so important to be able to understand the trends in both our viral and bacterial infections on tissue cases, because, you know, that way we can see a trend. The other thing is, if potentially one of those bacteria changes and now all of a sudden we see it as its own pathogen when normally it might have been a co-infection. And so those are the things that it's so important for us to continue to monitor. And I know there's a cost associated with diagnostics, but we do really derive a lot of needed information to be able to understand and manage it out on the farm, and also detect if we need to do something further or further investigation.
I guess with that, because we know co-infections, they happen all too frequently. When you have a farm that has co-infections, do you guys, and this is directed to you in the field mostly, but anyone can answer, how do you decide which co-infection you should target first?
Yeah, so I would say the ones that you have a solution for, right?
Yeah.
So do those first, right? And then you sort of work your way out. So it's like peeling back of the layers of the onion, right? So you take things that I know I can fix. I can vaccinate for this, or they have a working vaccine for that, or I can put in this strategy for the other thing. And then once you get past all of that, 9 times out of 10, there's more there that you didn't know. And so once you take those things out, then you're finding, oh, okay, this was another thing we didn't even know we had. And so then it gets into the, okay, now I've got to maybe build an autogenous vaccine, or maybe, you know, something new that doesn't exist, but there's technology out there that can help you get there and help you fix it.
Yeah, I would agree with Deb. You throw everything but the kitchen sink at it, right, just to fix it to start with. And so anything that you can find to deal with what you have going on as a co-infection, you're going to probably put that in for at least a short period of time, and then you start peeling back. And so, yeah, I would totally agree with what she said.
And probably I would add to that too, probably what's costing you the most, right? So if you have a problem with Circo, I mean, you're gonna fix that. Like, that's the first thing you're gonna fix. And then you're gonna maybe come back with, if it's erysipelas, and take care of that, right? Because the Erie I can kind of treat and kind of live with, although I don't want to, but the Circo you can't live with.
what would you guys say? I mean, because I was in the field, what would you say you see most commonly as a co-infection after a viral infection?
I think PRRS and strep go together really well, unfortunately. That's something I would see very often. And then anytime you've got flu, it seems like you'll have strep or GPS or something flare up as well.
Yeah, I would say higher-inus, GPS, probably top two in the nursery, because PRRS obviously can cause a scour in and of itself. It makes rotavirus really terrible, and E. coli is terrible. And so like any enterics that you're going to have that would be there, it's just going to magnify them.
For everybody, I guess, what do you see as the biggest challenges and opportunities for the U.S. swine industry in relation to endemic diseases? And I know we kind of touched on some of that currently with the PED elimination task force coming out, but any other areas you guys think are huge opportunities?
I think we've touched on a lot of what I think is an opportunity for endemic diseases, but maybe one other thing that I think is really important to just mention is recruitment of talent. And so I think that's a huge thing for us to be focusing on right now, and getting young people into our industry, showing them what's there, showing them what opportunities are out there for them, and just get them in. They'll get hooked on pigs. I did. But I think we need that new talent, or to work on our farms, right? And so if we don't have the people there to do what we're wanting to have done, we're going to have more endemic diseases too. So.
One of the things we're looking at really in support of that, both for labor reduction, because anything that we can do that reduce the time, the labor that's needed to do a necessary process, that's something we're focusing on. But we're also looking at some of the newer or some additional research to understand why do people do what they do, at least on the farms in relation to biosecurity. And so trying to understand the psychology, sociology of why people want to do a biosecurity procedure or why they don't. And so if we can understand that, then I think it makes it easier to help develop programs or, explain things better, or just how do we get across what we need to do? Because you're exactly right. We do need people, and a lot of people have negative connotation with farms, but you forget, people run the farms. So we've got to have and retain good workforce to deal with our pigs.
Yeah, Brent, can you explain a little bit? The typical response for a PRRS break in a sow farm is to do a herd closure, and I've done many of them over my career. They seem to take longer now, and then there's always that question, when is it over and when can I bring in naive gilts? The employees always think that the pigs look great, we can do it sooner than later. But can you give any advice on that and what you're seeing in the field, and just when because sometimes it feels like PRRS just laying dormant in the sow farm, just waiting for you to bring in some more naive animals. So just your thoughts.
Well, both Dr. Murray and Dr. Dalquist did talk about that a little bit earlier. Unfortunately, I've been out of the direct field for 3 years, but I think it emphasized a lot of what they said. You got to rely on your diagnostics, and I think we have to do more diagnostics than we did before for those longer closures. And I would really encourage them to comment again based on, sometimes you have to, deciding on if is control going to be possible, or do you have to do a depop? And I'm going to defer to our experts on the panel with that, since they're dealing with it on a daily basis.
No, Brent's absolutely right. You have to rely on diagnostics, and you have to really do a bunch of them to understand, is there a low level of PRRS still sitting on your farm before you bring those naive gilts in, because they'll find it, right? And so we've done a lot of processing fluids, which is a really nice aggregate sample. It's, we test a lot of pigs for a low amount of money, but then we'll come back and we'll do some wean pig bleeding as well, just to say, okay, it wasn't at processing, but is it there now in the older pigs? So there's a lot of testing, I would say, that goes into it. I know that there's a bunch of different protocols out there for different farms, but I think it's important to test those different populations at least. Some of the other things to consider too when you're doing PRRS eliminations is, does it always have to be load, close, and homogenize? Or can we be a little bit creative on that? Some of the clients that I work with would actually have an offsite GDU that they would expose feeder yields to for a period of time while they're going through PRRS, just to keep the parity structure on the farm and to have less, of that ouch at the end. So I would say between 9 and 12 months is kind of a typical time frame where we'd expose those gilts and bring them in. And the benefit of that is you've got all of your testing done by the time you're bringing in your last of your exposed gilts. Now there's risk to that because you have them off-site. They're maybe in an unfiltered area. Maybe they're not in a very good location. So you have to find those areas that you could do that in where you reduce the risk of bringing in something new into those gilts that then bring it into your farm. So that's some of the way that I guess I've gotten through some of those breaks is I'm going to be a little bit more creative on how so that I can maintain my production.
Yeah, and I'd say the question on when can you bring the gilts in, so definitely processing fluids, large pools, right? So pool, if it's a 6,000 head sow farm, we would think nothing of pooling 5 days worth. And if it's there, you're gonna find it. So it's looking at that. If you have the opportunity to monitor in the nursery, if you're single sourcing them, that's gonna tell your story, right? If that nursery seroconverts, even if it's 6 weeks in, you could leak PRRS, right? So you wait until you've got a nursery that made it all the way through, and then looking at your processing fluids. I know there's some that also will monitor family oral fluids and some testing on closer to a wean age pig, right? So no, I didn't start out with it, but did I pick it up along the way? And so looking at that as well. But I think you can't be afraid to build in a cushion. So it used to be, we said, okay, if we're negative on processing fluid for 8 weeks, we made it. But then we had a blip at 12. So it was like, oh, we better go 12. And then it's like, oh, well, now we're more like 15. So I think we've all kind of widened that window out. But I think part of that is also at the very beginning, if we didn't do enough sequencing, we might have had more than one virus in there, and we got rid of number 1, but not number 2. And so that's maybe that blip at the end. It's that other one that we didn't necessarily homogenize to. So I think part of that is to do a lot at the beginning, probably more than you think you need to, just to make sure you know what you have.
When we see a problem in a wing to finish side, for example, let's think that we see the pigs with a strong cock, and we should have a gap between when we send the samples and when we get the results. So what do you think that is the best step by step?
I think we're really fortunate because we actually have really rapid results compared. I mean, think about I order a cake from Hy-Vee, and they're not going to get that ready for you that day, right? And so we're asking an awful lot if we're expecting the lab to get the samples in, process them how they need to, and then get us a result that day, which actually does happen. So we do get that today, or even the next day. So I feel like we're really fortunate that we actually do have pretty rapid results. We're really blessed here for that.
Okay.
And I would say there's a lot of things you can do in the meantime when you're waiting for your results. You can use your best guess of what's going on and either treat for that or, do something with that. But Deb's right. We have awesome D-labs that we can get quick results from.
And it's nice because there's not a huge amount of labs that we've all got to work with. And so I know when I was in production, I had our diagnostician on speed dial. And so calling ahead, communicating with them, especially if you're going to do a large sampling run, then that just also can help speed it up. But then as much as, I know I'm a technophobe, so I admit that readily, but a lot of the D labs now you can have and build your accounts online. And so that's really important too, because then that speeds up the results process.
One question in the back.
So in Australia at the moment, we've been getting a lot of activity happening, so a lot of farm break-ins. And I guess the point of difference that I've noticed since being over here is that we've got a lot of exclusion and perimeter fencing, which I don't think you guys have or that I've seen so far. And they're still obviously getting in on farm, getting into our sheds. And what we've been finding is over a what we would call a long weekend, that they'll go to, say, 3 or 4 sites, and then they'll look back, the producer will look back and see an endemic break of a disease. Is that a pressure or something you see over here as a potential threat for PRRS?
It certainly could be. I would say it's not something that we've run across very frequently, but obviously it happens, right? We know that. So I would say you're totally right. Like, it's something we really need to be aware of, and we need to be watching and monitoring for. And it's always kind of a good feeling if you go to a site that, maybe it's a new site and somebody approaches you and says, "Oh, who are you and what are you doing here?" Right? But if you don't get that, it's like, why aren't you asking, right? So it's kind of that training on your people, and when they're there, they're recognizing something that's out of the ordinary.
And we're down just to our last couple minutes, so I do want to give the panelists a chance. Any closing remarks or anything that you wish would have been asked that didn't get asked, or something you'd like to touch on? I know we had a lot of questions and a lot of really good questions.
I would just say, don't forget about the basics, right? Because, like, if an animal's dehydrated, they're more prone to get sick, right? So, like, look at your water pressure, look at your water nipples, look at the basic stuff, and look at your ventilation. And so 9 times out of 10, it's like, yes, you take something like, oh, they have a little bit of flu, they're fine, to like, geez, this is really bad because we didn't get the ventilation right, or we didn't get the water right. So I think just get the basic stuff done still goes a long way.
I think that's a really good point, Deb. I think nutrition is the other piece that we didn't talk about today here, but plays a huge role in how healthy our pigs are. There's a lot of work on the microbiome, too, that's helping us with diseases and keeping our pigs healthy. So stuff we didn't get into, but do some more research.
And there's a lot I think we're blessed in our industry, and granted, I've got a little bit of bias, but working with all of the associations, whether it's the swine veterinarians, it's National Pork Board, it's SHIC, it's NPPC, we really are blessed with a group of people. And so if you ever feel like you get a question, a challenge, or a problem, there are resources out there, both through our veterinarians and other associations. So you're not alone in this, and there are resources available to help with some of these really big challenges.
Oh, thank you, and I just want to remind everybody, pork checkoff and SHIC, like we're here for you guys. We work for you guys as producers. So please, if there's a concern that you don't feel we're addressing or we need to address, please communicate that with us, or we're areas we focus on what you guys tell us to focus on. So I just kind of want to put that reminder out there. And with that, I really want to thank you, our panelists here, for being with us today. You guys threw a lot of really hard questions at them right off the bat, and they responded way better than I was going to be able to respond to any of those. So thank you.